Okay, so I think we'll make a start. So welcome everyone to this webinar on the American residency application and the interviews. My name is Anka Kajuria, and I'll introduce myself and as well as my team very shortly. So the objectives of today, we're going to basically go over what are the pros and cons of moving your career to the US. We'll hear from the speakers today who are all IMGs, and we'll hear from them in terms of what are the challenges that are commonly faced by international medical graduates. We'll then go over some of the other components of the application process, namely the USMLEs, the letters of recommendation, and the US clinical experience, and forms a crucial part of the application process. And then finally, we'll hear from one of our colleagues who's actually has just been through his interviews to give you the most up-to-date information. And then lots of opportunities to ask questions throughout the process. As I said, type them in the chat, and we'll go through as many questions as possible today. Okay, so just to introduce myself, so my name is Anka Kajuria. I'm a plastic surgery resident based here in London in the United Kingdom. I was ranked first in the UK Plastic Surgery National Selection. And my research has been based both in Oxford and at Imperial College, also in London. I've been fortunate to publish and present my work internationally, and have also authored a textbook. And I sit on the editorial boards for Systematic Reviews Journal, as well as the advisory board for PRS. I'm passionate about medical education, and the fellow of the Higher Education Academy and the member of the Academy of Medical Educators, and have been nominated for some national teaching awards. And I founded High Yield UK back in 2015. Okay, so High Yield UK is an international consulting and coaching service where we really focus on competitive residency applications, both in the UK and US, as well as some postgraduate exams. The tutors are handpicked. We select the best tutors. They're all high yield, as well as the consultants. And the ethos is really to maximize your time to provide a high yield service that maximizes your scores in any competitive applications that you undertake. We also are focused on evidence-based, and all the faculty you'll see today has a strong academic background, and in all of the programs that we run, we like to collect data, and we've published a number of articles in the past to support our teaching methods. And we're pleased to say that our previous delegates have ranked top 10 nationally in many of the UK programs that we have run. And these are just some examples of the work that's been published. I'm very pleased to have some fantastic speakers today who are going to share their experiences and some of the key components of the application process. I'll let them introduce in more detail, but I could basically take 5 minutes to introduce each of them in terms of how much they've done and how much they've achieved. So very briefly, Dr. Mohan is a plastic surgery resident, currently based at the Mayo Clinic in the US. She's an academic. She's got a PhD from Cambridge, and is very experienced and a keen medical educator. So we'll hear from her very shortly. Dr. Malki Assad, he's a postdoctoral research fellow currently working at the MD Anderson Cancer Center in the US. Actually been through the interviews very recently at some of the top institutions in the US. So we'll hear from his experience. And finally, Dr. Farah, who is board certified in internal medicine and is currently a preventive medicine fellow. And we will hear from her experiences as well. Okay, so this is the outline of today. So we'll shortly have Anita go through why the US, what are the pros and cons, and what are the challenges faced by an IMG. We'll then have Wigdan go through the letters of recommendation, the US experience, and the USMLEs. And finally, we'll finish with Malke going through the interview preparation and some tips. And we'll then open the floor to any questions that you have. So thank you very much. That's a quick introduction for me. Those are our contact details. That's a QR code if you want to follow us on Instagram. Lots of these events are going to be coming up, and that's where we will advertise these. So if you're interested, you can follow us and then stay up to date. Brilliant. Okay, so without further ado, I'm going to introduce Anita. Anita, if you can kindly share your screen, and then we'll take it from there.
All right, can everyone hear me okay? Excellent. So welcome everybody this afternoon, morning or evening, depending on where in the world you are tuning in from. So the discussion points that Anka has given me today is why the USA? Challenge, and which I feel like is a difficult question. Thanks, Anka. Challenges faced as an IMG and some of the strategies to overcome. And then we're also going to be sharing experiences with the rest of the team as well. And so some of these points might be overlapped or rediscussed. So why the USA? Well, is it still the land of opportunity? That's probably depends or debatable. But sort of in terms of other opportunities, some people choose the US is because of the job. So career opportunities, excellent training, potential for academic progression. Sometimes it's family, lifestyle, is it the culture, and also the money. So, but whatever the reasons that you're choosing to apply to the US for residency, it's going to be kind of personal reasons or a sort of a range of personal reasons. It's an individual kind of response or choice, and it's your story. So you are going to potentially be asked this question. So I think it's very important that you prepare a response. So what are the motivations? Or what are your motivations? So it might be due to the academic and training programs. It might be something specific to the specialty. It might be related to your future aspirations and where you see yourself in 5 to 10 years, or maybe very personal reasons. Whatever it is, also be very honest. And probably, even though it might be like a small thing at the back of your mind, don't say it's for the money. Your motivations and your responses should sort of lead to, when you're presenting it, be aspirational, demonstrate your enthusiasm and your drive, and be goal orientated. Okay, so pros of applying to the US. So they have structured training programs. There's the quality of training and the experience that you can get. I just put some asterisks just because, you know, it's not, there are other countries as well around the world that also have excellent training and experiences too. It might be related to the specialist types of training, greater opportunities in terms of jobs. I mean, it's a very big country, so geographically there's lots of job opportunities, and maybe it's the range of the types of practice you could eventually go into, whether it's academic, group practice, VA systems, or private practice. In terms of research, there's lots of funding, resources, potential academic opportunities. The compensation in terms of when you finish your residency is, I think, considered very good and one of the better countries in the world to work as a doctor. And also quality of life. So there's potentially good compensation, and it also, quality of life, maybe sometimes it's debated during residency, but once you finish, there's a lot to say in terms of that aspect of it. And that does depend on what kind of specialty and field and where you do end up. In terms of cons, well, you know, you are considering moving country. That is a big deal. Also consider your legal status, whether you have citizenship, require visas, green cards. This is also important when you're considering fellowships or additional training and looking for jobs. Remember, not all the programs are the same in terms of what they offer, in terms of quality and structure. So you need to do your research. And also, if you are having to come on a J1 after residency, or when your J1 visa is up, you may have to either work in an area of need or go back home to your home country for a couple of years before you're allowed back. Now I'm kind of blending the cons and challenges. So sometimes you might only be able to apply to more less desirable locations for residency, which have more positions available, and that might be in bigger cities or rural, so that might be a better chance as an IMG to get those positions. In general, everything's very competitive, so there might be limited positions at each program. It does cost to apply and interview, so that is one of the cons. And additional challenges or cons is you might have to, as an IMG, invest time doing research. So that does take up time, and also you have to consider how you're going to fund yourself during that time. Looking into residency, one of the cons is the work hours. So as you know, the ACGME have the 80-hour sort of working rule, which compared to like Europe is, we had in Australia, it's 40 hours. So it's very different. And that also, in terms of work-life balance, there's more of the work side of things during residency. But it does sort of, it is different in different specialties. And also consider, when you're considering your specialty, there are different lengths of training programs. Are you applying for a 3-year one versus 7, medicine versus surgery? All of these things kind of influence that too. So this is sort of stating the obvious. Another challenge is, as an IMG, applying to the US residency is highly competitive. So needless to say, with your application form, high scores are important, and you have to look at strengthening other elements of your ERAS application form as a whole. Consider the clinical experience or US experience, research experience. These are all important factors. And there's also other elements on the form which are written there. That's voluntary, presentations, abstracts, awards, roles of responsibility, other graduate degrees. And I've put a link in there, which I think is quite useful to look at, because it shows a bunch of charts that kind of go through like scores and how IMGs have matched into all different specialties based on whether they had all these different elements. So I think it's just interesting to look at that. Other challenges and barriers. So in terms of the selection process, generally, they're going to be a lot of times they're looking at, when you're seeing an IMG application, where did you go to school? What are your scores? Do you need a visa? Unfortunately, despite how amazing your other elements of your application forms are, this is like the first biggest hurdle you're going to try and have to overcome. And other elements are, US clinical experience. That kind of demonstrates like familiarity with the system, and being able to work, kind of work and understand the system is always a benefit. I think if you have contacts and connections, either through research or rotations or any research work you've done in the US, you have to try and utilize everything you can to help you in this process. And remember, things like personal statements and recommendation letters are usually read after you're already selected for the interview, not for the actual selection for the interview. And other barriers is the cost to apply for interviews. The more applications and more places, the more costly it is. Briefly, and I'm not going to dwell on this, but legal status is important. J1 visa, needing that is a big disadvantage, especially in very competitive programs. H1B is a bit better, but it's costly and it's not actually offered in many places. And trying to have a permanent legal status or a green card is obviously better, but that in itself costs money. It's a long process. You should start early. You should seek advice to see if you're eligible. And there are other types of situations, which I won't go into, but those are the main ones. So strategies to overcome the barriers. So I guess a lot of these are kind of obvious again, but be prepared to answer some difficult questions and really understand your motivations so that you can really express your achievements, your strengths, and what you're going to bring to the program and how you're going to enrich their program. Try and get a sense of the culture of the program you're interviewing at. Just like with any job interview, you're going to do your research a little bit. So you're going to be able to engage with that program, with those people interviewing you, and you really understand where you're interviewing at and the environment there. Don't be put down by certain comments. I think when I went through the interview process, and the others can share their experiences, sometimes they try and say slightly antagonizing things about being an IMG. don't let that put you down. Turn it back to your strengths and about what you can offer to the program. Be confident, be honest on your application form and in the interview. And another important thing, which I feel is important to express, is work on your interview and communication skills. Whether or not English is your first language, I think I was shocked by the number of IMGs who are applying in the last couple of years who actually haven't really practiced much at all in terms of their responses to questions. And it's very difficult. I also, I worked in the UK and interviewed there, and Anka will contest to this. We prepare pretty hard for those interviews, and because it's competitive, and I think it's very important that people do that. Here's the thing. So some of the other barriers or challenges that you might get is, maybe the programs are going to have, some programs might have preconceived ideas that IMGs are not as good or competent as the American graduates. I obviously disagree with this on some basis. But, some of the comments I've seen online was, standardization of schools internationally and license committees are not equal. And the programs might be looking at what university you're coming from. But the positive things are most IMGs score actually higher on objective tests and board examinations. And, it's important that if you are applying, you should work hard to get the best scores possible on your USMLEs. Again, when you're faced with questions alluding to this, emphasize and highlight your strengths, your achievements, demonstrate your ability, and tell them what you can offer to the program. You might be asked, why are you as good as a US candidate? I was actually asked in a roundabout way, I was kind of asked this. And again, it's a repetition. You want to just highlight your aspirations, show your enthusiasm and your drive, goal-orientated of why you're applying to US residency, and really bring across and tell them your unique attributes. Because at the end of the day, they're going to be looking at, as a resident, will you succeed in the program? What are you offering to us? And are you going to be a good candidate and a good fit? And, these are all things that they're thinking about when they're interviewing you. These are some charts, last couple of slides, just some positive things. So this is from ECFMG's website. You can Google this. Now, the sort of participation of IMGs and the acceptance rates and those being matched have increased sort of last year, and that's a positive sign. So IMGs are doing, better and good. It's not all doom and gloom, though it's still competitive. This was a chart I found. It's showing like the top 10 IMG friendly states in the US. Again, this just shows the increase in acceptance rates for IMGs and programs are going up. This is specific to some surgical subspecialties. This is just a blurry excerpt from a paper that we submitted on diversity in surgery. And it just kind of shows, this is national data on the ACGME website, but specialties that kind of have promoted, like have better IMG acceptance rates was like plastics independent over the last years. This is 2011 to 2018. General surgery, but you can see like ortho, ENT, urology, they're pretty poor to non-existent in terms of IMG acceptance. Neurosurgery actually was pretty decent. And then again, this is that PDF and link to that website I was mentioning, which shows kind of match rates for IMGs, and it goes through very specifically some different elements about their presentations, those who had higher degrees, those who had US experience, those who had voluntary experience. So I think when you're applying, like really sort of look at that and look at your application to strengthen those elements. And at the end of the day, you should stay focused. Don't give up. It's a good move. Again, it's to do with contacts, US experience, gaining some connections. Otherwise, doing the 1 to 2 years of research, it basically is supplementing your application form. Like I said, it's not just the scores. you've got to look holistically at your ERAS application form. And part of that is, it's right there, is research, presentations, abstract. So if you can maximize those elements of those categories on your ERAS application form and do it in the US, you're kind of like building your connections, you're presenting in the US, and you're building up that part of your CV. I think that does strengthen your application form.
Cool. So we have got, what would be the route for a US IMG? Can they be matched before doing their step 3?
Yeah, I think you can. Yeah, I mean, I matched before doing step 3, so
Okay.
I don't know if something's changed, but Malky or might be. I think having it before you, if you've already done it, I think that's also maybe better, but it's definitely to do it before you start. That's before you start your post, but you do not need it to match.
Sure.
Yeah, definitely. So step 3, mainly people do it for visa reasons, to get the H1 versus the J1, but it's not required to match. Some people use it as a strategy if they didn't have good scores on step 1, step 2, to kind of get a good score on step 3 and present the program, but it's not required to match.
Okay.
The only one thing I would actually add into this, which was going to be a concern, is with USMLE shifting from a national society, moving more from scores exam to pass and fail exam, then for people who are applying after 2022, it's going to be more of it. Having the 3 exam may be helpful for IMGs just to prove that, because you don't have the same elements, and we can go through this later on. But yeah, that's one of the things that's may be helpful for other people in the future, just to have the 3 exam to prove yourself.
Yeah. So I think that's a question that's come up quite a lot. So I'm going to put that to all of you. So what are your kind of views on the USMLEs becoming pass-fail, the step 1? And how do you think the institutions will sort of view IMGs who've got a pass-fail score, a binary score, versus, you know, someone's got a triple-digit score? So we can start with Anita.
I think given that, that's an excellent question. I think given that before with the step 1, it was, I was told from a lot of people and program directors that there's a cutoff. You don't meet that cutoff, they're just not considering you. Now that it's a pass fail, I think there's probably then going to be even more importance and emphasis needed on your step 2, maybe the clinical skills, your work experience, and all those other elements on the form. That's why I was saying, look at your ERAS form holistically. There is lots of different sections, and you probably have to also work on making sure everything is like as beefed up and as impressive as it can be.
Malke?
We actually did a study. We surveyed the plastic surgery residency program directors and asked them about the factors that would play a role after the change. And it seems that letters of recommendation, knowledge of the applicant would be the highest importance, and then it would be followed by step 2 and research. Research didn't take that much importance, especially in a specialty that had research is important generally for application. It didn't get that high importance. Also, the medical school, I was surprised. I assumed that the medical school where you graduated should be on the higher rank, but it didn't rank high. In another study done by Vanderbilt, and they actually surveyed all residency program directors across the US, and the majority said that they would require applicants to submit their step 2 CK before the application, because American grads don't have to do that when they apply generally. So step 2 will probably become the new step 1, more research experience, more people going into research fellowships prior to applying to residency.
Great. Wigdan, anything to add to that?
I really agree with Anita and Malky. It's the same thing. It's just more of the scores part is going to be moving from that. It's going to be just a challenge to build your CV from the holistic approach and making sure that you're filling the gaps that other American grads may not focus on, but you may actually take that for your advantage and work on.
Yeah. We've got another question with regards to research. A lot of people are sort of fixated on, their outputs during that research year. How important is that versus the connections, would you say? Malky, do you want to start?
So,
Or Wigton, yep, go for it.
Malky, go ahead. I will just answer after you.
So I would say both are extremely important. Publications without the connections, and by connections I mean your support, the support of your mentor, or how well known your mentor is, how influential in the program or outside the program, and the output. Because when they try to reach out to people or to match you in the same institution, they want to have an evidence that you're actually getting something out. There has been some studies looking at what would program directors consider as productive, and generally they would say around 4 to 5 publications a year with 4 to 5 presentations would be considered productive. So as long as you achieve that or more, that would be considered good. And also your connections when you attend meetings, having the support of your faculty at your institution, that's the most important thing.
Okay, perfect. So I think in the interest of time, we'll move on to Malky's presentation, and then we can pick up some of the questions later.
Are you able to see the slides? Perfect. So, hey everyone, my name is Malky Assad. I'm originally from Syria. I went to med school in Aleppo, and then I did 1 year of research at the Mayo Clinic in plastic surgery, and now I'm currently a research fellow in the Department of Plastic Surgery at MD Anderson. And I'm also applying to the MAJ this year, so going through this process, I'll be happy to answer any questions you have. So the first thing that you need to do when you're preparing for interviews is know your CV, especially for people who've done a lot of research or they've listed activities on their CV from their mid school or publication that they worked on maybe 5 years back. That might be something hard to remember. You have to list these things on your CV because you've done the work and you deserve to receive the credit for that. But be sure to answer questions. So in case, for example, somebody asked you during the interview, can you tell me please about this publication that you worked on regarding, for example, Crouzon syndrome? And if you told them, I've done this 5 years back, I'm sorry, I don't remember, that's not a good thing. So make sure that you know every single thing on your CV extremely well. I know that might seem obvious, but I've seen some cases where applicants are asked about publications or they list hobbies and they don't do them anymore. I know in interviews were actually in person, an applicant listed that they play the flute on their CV, and one interviewer handed the flute to the applicant and the applicant couldn't play. So just make sure that you know your application, you're confident about every single thing you do. For example, me, I know German, and I passed the B2 German level when I was in my final year of school. But now I forgot most of the things I learned. So I did not put advanced on my CV, I put basic. So just make sure that your CV is accurate 100% and you're confident about every single thing on your CV to talk about very clearly. The hobbies, sometimes they just pass by to the hobbies area and they start asking you. So if you listed that you're a basketball player and you don't know the basics of the game, that's not gonna look good on your in the overall assessment of your interview. The other thing when you're preparing for interviews is to research the program. This is something that you can do even prior to applying, because you don't want to be applying to a program that would not help you achieve your goals. For example, let's say you are a person who is very interested in research and you're going to a program that does not do any single paper a year. So that would not be a good fit for you. And for example, when you're asking them questions and telling them all about your research, that would appear not as a good fit for the residency application and for your overall assessment. So make sure that you research the program before you go in, before you even apply, because residency application is expensive and you want to make sure that this is a good fit for you. And the other factor is that when you're researching the program, you're going to be asked at the end of each interview to ask a question generally from every single interviewer. If there was time left, do you have any questions for me? And you have to ask at least 1 or 2 questions to make them feel that you're interested in the program and you know something about that program. So for example, let's say you were interviewing with the cardio fellowship at that program. It might not be the best option to ask them about the GI fellowship match rate, because they are in the cardio. The same for plastic surgery. If you're interviewing with a hand surgeon, it might not be the best option to ask them about craniofacial experience in the program. So usually they send you the list of the people that you'll be interviewing with. So read about them, read about their publications, their interest, their clinical interest. Generally, these things are on the websites of each program. And also read about the program, because you don't want to be asking a question that is available, the answer is available on the website. For example, let's say they have the fellowship match rate on their website. And when you're asking, you don't want the program director to tell you that that information was already discussed or is available on the website. But you can take that question and dive further. For example, if they had a fellowship match rate, you can ask them about where the graduates have been going in their fellowship. So I know that they match in these type of fellowships, but have they done research prior to doing that? Do they take years off? Do they go and do rotations? So you can dive in the questions further and always make sure that these questions are trying to help you rank the program or understand more about the program. So that's why residency program is very important to how you present yourself and what is the best way to learn about the program. The other thing that you need to prepare for interviews is the interview questions. I generally divide these into 3 main categories. The first one is the common questions. And the common questions could be, tell me about yourself. This is a very common question. And as Anita mentioned, you have to practice. Interview it might seem easy, and you have to talk about yourself. You have to be genuine yourself. You don't have to act as if you're somebody else. But what Anita meant by training and practice is try to summarize your story or your strength in an easy way when you're answering these questions. For example, tell me about yourself. You shouldn't be going for 10 minutes. You have around 1.5 minutes to talk about yourself. So you need to pick what you think is the best way to present your strength, with what would fit with the program. So if the program has a very focus in research and you have a wide area of research experience, publications, presentations, you might shift a little bit more time to that aspect of your CV for when you're telling about yourself. If the program had more clinical focus and you have clinical, so you're not trying to be someone else, but you're using your strength and present it depending on the type of program. So that's why you need to practice a lot, have like a sheet at the beginning of your preparation, write down your strength and how you can present each point during the interview questions. So tell me about yourself. You can start by telling who you are as a person, where you grew up, how you went to med school, your general story, like a timeline of your academic career. And you can tell as a person what you like to do, your hobbies, what drives you into the specialty. But here briefly, because here you're not being asked why did you go into the specialty. So just very brief highlights of your story, with the focus more on telling who you are as a person. Another common question is why the specialty. So make sure that you prepare for this question. Try to reflect back on your life and look at what are the main reasons that made you go into that specialty. It's good to have a story, but don't focus the whole thing about, I saw this case and that's it. I fell in love with this specialty and I wanted to do pediatrics or plastic surgery. It's interesting to have a story, but it's generally the decision to go into specialty is more complicated, and don't make it seem that simple. So a case could spark your interest, and then the other things that you've encountered during your medical school or your rotations, we kind of re-emphasize that, and then you decide to go into that. Another common question is why the program? This is why you need also to research the program, because you don't want to say that I'm interested in this program because of research and the program does not have research, or I'm interested in this program because they have amazing cardio fellowship and I want to do cardio fellowship and they don't have that. So prepare an answer for why the program and what are you looking for from a program. Are you looking for a clinical experience, for research, for the team, for educational opportunities? So define your goals, research the program, and you can adjust your answer based on what you're looking for. Another one is, what are your goals? Where do you see yourself in 10 years? Your strength, your weaknesses. So these are some of the common questions that you would commonly encounter on your interviews. And it's always best to practice and prepare points for all these questions. And you'll get better. The first time it might be not as good. And then the second interview, third interview, you would feel that you're improving. Another category of the interview questions are the behavioral questions. Sometimes the whole interview might be behavioral questions. Sometimes it's only common questions. So it varies based on the interviewer, what they like, and the specialty. So for behavioral questions, just an example. Tell me about a situation where you had a challenge and together as a team, you overcame that challenge. Tell me about a scenario where you had an angry patient and how did you deal with that? Or what would you do if you were faced with the ethical challenge, or faculty did that and you did not agree with them? How would you handle this? So these are generally tougher questions because it doesn't relate directly to the common things that you encounter in life. So it might be a story that happened 3 years ago and you have to recall all this. So that's why it's good to prepare scenarios from your life and from your medical school rotations to help you answer these questions. Because you know your goal every day. It's obvious and you can answer that easily. But recalling a story in a stressful situation like an interview might be harder. So also prepare for this very well. And there's generally, this is a nice strategy I use, the situation, task, action, result. And you can start by telling the background of the story. For example, I was in medicine rotation or surgery rotation and in my 4th year of school. So you're kind of giving a background of the story. I was faced with an angry patient, and the patient was waiting, for example, in the ER, diagnosed, for example, with wrist pain. So you're kind of giving a background of what's the story, what is the scenario here, and what was the task. For example, let's say the angry patient scenario. The patient was angry because he was waiting for a long time in the ER, and there were so many patients, so we could not attend to the patient quickly. What did you do? For example, I went to the patient, explained to them that we have more patients that we usually encounter. We'll try to get to the patient as soon as possible. The patient was shouting in pain. I went to the nurse. You're kind of describing what the action you took in order to resolve the problem, and what was the result. The result is generally the patient agreed, or the patient was seen at the end, and also try to add a learning point. For example, I learned from this that maybe, for example, for the angry patient, that when counseling the patient, educating them, communicating with them would help de-stress the situation or de-escalate the problem. Another category is these weird questions that you don't prepare for. And I've heard some example, give you a few examples here. Tell me about, or which element of the periodic table would you identify yourself with? Or which tree, or which animal? So there are here, do you have examples of these? I see you.
Yeah, I had what would be written on your gravestone, which is a little bit morbid.
I had described the yellow color to a blind person, like.
Yeah, so you might encounter these questions and you will be thrown off. Like one person asked me, what kind of music list would you like to play in our OR? Like these weird questions that you have to, and always remember there is a point from asking this, and try to understand what's the point and answer that question in that regard. They're trying to see if you're a normal person wouldn't answer a question in a very weird way. There is no right or wrong here. It's not like this is a perfect answer, nothing else is right. No, there are multiple right answers, and it's just they want to see how you reflect on problems. Virtual interviews, since now we're doing the virtual interviews, we're not going to in-person interviews anymore. So prepare for that. I've made a video on my YouTube channel. You can search it under my name, Malki Assad, and just have a quiet place, nice background, not have light into your face. Not have light in your background, so the interviewer can see your face clearly. A ring light could help, good camera, good internet connection, good sound. We also published a study about, a review article in the Annals of Plastic Surgery to talk about the general recommendations for a virtual interview. And the final tip is practice, practice, practice. Since virtual interviews are now the mode, don't know how it will change next year, but it's easy to practice on Zoom because you can record the interview that you're doing and see it yourself and see if you're satisfied with your performance. So this is the mode that people will be seeing you through this camera, through the same audio and video settings. So record yourself, practice with friends, residents, fellows, and see if there is anything that you can improve. Take their tips, and the more you practice, the more you'll be efficient at this. One very important point is that sometimes when you practice too much, you seem rehearsed, and it might be harder to seem natural again after you practice the same question 100 times. For example, why this specialty? I've been asked this question in 4 interviews so far, over 20 times, and it might be hard in the beginning to seem natural and genuine, and it's as if you're asked the first time after you answered it 20 times. So you have to work on this, practice as much as possible to make it seem natural and not as if you're reciting a text or something you're reading from a book. These are my tips. If you have any questions, you can follow me on Instagram, Twitter at Malki Assad, and you can check my YouTube channels. I've posted several videos, including one related to the step 1 pass fail. Thank you, everyone. I'm happy to take any questions.
Brilliant. Thanks very much, Malki. Let me start with a question. So obviously you've just come to the end of the interview trail. Looking back with the benefit of hindsight, what's one thing you would have done differently?
That's a nice interview question. One way is if somebody has not prepared well, preparation and learning about the program is the key. I've encountered some of these unique, weird questions, and then I searched online and I found some of them online. So preparation, I think, is the key. Trying to understand about the program, because interview is two-way communication. It's not only for them to assess you, but also for you to assess the program and to assess whether this is a good fit for you and whether you want to be there and how to rank the programs at the end. So have a sheet of talk about after each interview. Don't delay this. After each interview, type down what your impression of the program is and whether you would be happy there, their clinical volume, their team relationships, and kind of keep track of these when you're in your interview trail.
Okay. Let's see. We've got a few other questions. Do PhDs help for applying for competitive residencies? It's open to everyone.
I think a better person to answer that question, but generally, if we look at the NRMP data, the one that Anita showed, there is no big difference between those who matched with the PhD and those who did not match with the PhD. So I'm not sure how PhD would help, how much it would help. Definitely in programs that have good research experience or heavy stress on research, but generally a PhD is not like the main breaker of selection.
The only field I think they actually take into account PhD is actually the pathology. So if you're applying to pathology and you do have a degree in pathology, that could be helpful for you. Or if someone applying for a medical genetic degree, that could be something these programs actually look into, because people are actually double certified. There will be MD, PhD. Some of the more competitive fellowship like Radonc fellowships or residencies in the United States, also majority of the residents are actually MD, PhDs. So that could be one of the things that would be helpful. One of the tool people actually use to restart their, if you're an old graduate and you try, and this is one of the factors that program look into when you graduated and if you're an old graduate. So some people use the PhD as a starting point to like, I was not doing anything. I was working on my PhD and that was the focus. So that's the only thing that come into my mind for benefit or browse of doing a PhD.
I've got another question. Is there a cutoff for, sort of years out of medical school when, programs might be like, it's you've been out of medical school too long, or, you've already sort of partway through your residency, or even, have completed residency in your own country. Do you guys know if there are any sort of cutoffs that they use?
3 years and 5 years for internal medicine. I'm not sure about surgery, to be frank.
I think programs vary. Some programs have maybe 4 or 5. Some programs do not have these filters, some do. So I think it varies. There is no specific cutoff for all programs across the US.
Anita? You're muted.
Sorry, my connection had disconnected, so I was just trying to get back logged in. Just repeat that. I missed the beginning of the question, sorry.
So the question was, is there a cutoff in terms of years out of medical school when programs might be a little bit, discouraged to take you, basically?
Well, I'm going to be biased because I was quite a lot of years out of medical school. So I'm going to say no. What did you do in that time? I think is important. Did you not do anything and sit around and not be productive? Well, that doesn't look good. But if, for example, I had clinical experience and it was very broad, I was still publishing, I was still doing, I got an extra degree. That was my explanation. So, so I don't think so. As long as you were utilizing your time and they can see what you were doing in that time, then that's always a positive, and that's what all going to be on your form.
Sure. And then one final question before we go on to Wigdan's talk. So we've got an IMG colleague who has done a lot of research. He has a PhD and he's partway through his residency as well. How much time do you think he needs to spend going over to the US to do a research fellowship or not, given that he's published so much already and has a PhD and is partway through his residency?
I was going to start because it was funny because I spoke to some people about this, and so I'm in plastics and spoke to some people and program directors regarding that, and a lot of them were saying, well, you have to come and do research with us in order to really be considered for our program. And I'm like, well, I have a PhD, I'm getting my PhD and it's from Cambridge, etc. And there's like, yeah, that doesn't matter. They still wanted you to do like 2 years with them before they would even consider you as an IMG, like into the program. So I think it is variable. I don't think that's a hard rule. Lots of people, the average answer is like couple of years to, build connections, build a research, depending on the type of research. If you're doing basic science research, it obviously takes time to set up those things. But, some people have been extremely productive and have managed to get it within 1 year. There is no there's no rule per se. I really just, some of it's luck, some of it's productivity, and a combination of factors. But I've been told doesn't matter like how many degrees you have. It depends. I think that's what I mean, the culture of the program and like what are they looking for. Like there's no set answer, I don't think.
Yeah, I agree. It varies between programs. Depends on where did you do your residency. If you did it in country that people in the US are not very familiar with, it would be way harder than, for example, in the UK or Canada. Who your mentors in these countries are, can they recommend you, and do they know these people in that program? The culture of the program, the publications, it's a very it varies a lot between programs, and yes, they might have a shop, but it's always better to have that personal connection with them.
Perfect.
And you want to think about it while you're doing that experience also. If you're doing it for the letter of recommendation, then that will be the thing. You need to spend some time with them doing it in the United States.
Yeah, perfect. So I think that's a perfect segue into your talk, Wigdan. So we can talk about US clinical experience, and especially, currently, the fact that we're in a pandemic, the challenges associated with that, and then we'll talk about the USMLEs as well.
Sure. Are you guys able to see my screen?
Yes.
Okay, great. So I'm actually going just to go briefly about, Anita and Nauki actually covered a lot of these points, but one of the most important things I wanted to talk to you guys about is, if my screen allow me to do anything today. So the one thing they want to talk, Anita and Nauki actually was talking about the NRMB data, and this is what programs look at for majority of the time, this is the data from 2018, and this is the last data the NRMB actually produced or aggregated the data together. And when you look into it, letter of recommendation and step 1 score were one of the 2 factors that were very high for people to screen. So they put in them most of the time for the filters, and the filter will be like year of graduation for some programs, cutoff point for a step scores, and then they look into majority of the time your letter of recommendation just to make sure if they will be taking you in or not for an interview. And then the difference will be for the ranking process. If you notice that the steps score and majority of it will go down, but the letter of recommendation still will stay up within the first 4 factors for why people actually either get the interview or being ranked for the subspecialty. And this is across the spectrum for no matter what subspecialty or specialty you're actually applying to. So that's being said, I just wanted to talk about the letter of recommendation. So majority of the program will ask you to have at least 3 or 4 letter of recommendation sent to them. Majority of them will ask for 1 or 2 of the letter of recommendation is actually within your specialty that you're applying to, if you've chosen a specialty. For some of the programs like emergency medicine and ENT, they will ask for standardized letter of recommendation. So these are actually certain form. They have to be going through a certain process, and the people who are filling these letter of recommendation for you should follow these structures. For ENT, I know that the letter of recommendation that's being sent should be modified in a certain way to fit with that picture. Some people sometimes confuse the dean letter or the MSBE with letter of recommendation, and they're not. This is a different set of criteria that you're sending, and this is your school actually sending back saying this is the performance of this student and how they did. For IMGs, like from my personal experience, and I'm not sure Malky and Anita can actually wade into this also, but from my programs, like talking to my program director from my training or even going through my fellowship right now, when people are talking about the MSBE, it's actually because it's coming from outside of the United States, this is mainly more for American grads or people from here. So it put a lot of weight for an American grad, but it's a little bit different when it's coming out from outside of the country for IMGs. And so this is the main things you want to think about. So when talking about this, what make actually your letter of recommendation or the letter of recommendation is actually a strong letter. So recent letter for people who are applying within the first year, if you're applying the first cycle, then you get your letter. But then let's say, God forbid, and you didn't match and your letter is actually staying in for 2 years, the older your letter gets is actually make your letter of recommendations a little bit weaker. You want to focus on clinical experience in the US for your letter of recommendation, because that's really helpful and represent the whole idea of what Anita was talking about and Malky for showing that you actually know the system and building the connection for that. And also, you want your letter of recommendation to be from the specialty. So if you're applying for internal medicine, you don't want to have a surgery letter of recommendation coming in for all of your letter of recommendation, because it's just going to tell that you're not committed to the field that you're applying to. Who should write your letter of recommendation? And that's really an interesting question. It would be a challenging question for a lot of IMGs, and it was one for me when I was applying. So majority of the time when you want to think about that, you want someone from the United States, but you want someone who knows you well. So a research mentor will be a good one. If you've worked with them very well, they know you, they know your work ethics, and they can attest for that. And that's what the program directors are actually looking for. They want to look for a person that writing a letter that they know you, they can say that you actually do work. You want someone who saw you working as a resident or a capacity of a resident. So that will mean if you did an American, like if I did a rotation over here in the United States, you have the attendant you worked with write that letter for you and build the connection with them during that clinical experience. So they will be able to attest for you and say, yes, we saw them working, this person is really good and their work ethics are great. So having these 2 letters of recommendation from the subspecialty or the specialty you're applying to is very important. And then think about your 3rd and 4th letter most of the time to have the person who, a research mentor or someone who will talk about your personality, your work, how you are actually outside of just medicine, but in general. The one other thing that programs actually look at from looking into the data from outside, program director look at, they want to look for someone who they know. So think about who you're actually writing this letter. If I'm sending a letter to Mayo, let's say for my fellowship, and I know that someone, or for your residency application, and I know I worked with this person at Mayo, they know me very well, it's very nice for the program director to see a letter from someone they know, because it's going to be helpful for them also during that process. One of the challenge that meet IMGs a lot of the time is actually having letter of recommendation if you did not do enough experience. So the question come up most of the time, do letter of recommendation that come in from outside of the United States actually hold the value? And that's a question. So the debate on this is still on, and people will say not most of the time. So if you're going to get a letter of recommendation from someone from outside of the United States, they need to be someone who well known in the field, and people who actually people will attest with them and known in the field and from an international level. So that could be helpful if that's the person you're working with. And that will take me actually to talk just about your US clinical experience. So there's different ways people will be able to obtain a US clinical experience. The problem with a lot of the people in the United States over here for IMGs when they're moving to the United States is if you already a graduate, it's very hard for you to find a clinical experience that's hands-on. So my recommendation will be a lot of the hospitals actually offer a way elective for medical student, but as soon you hit the graduation year and you have your diploma, it's very hard for you to actually get access to these. So if you're able to, if you're working on this during medical school and you're able to find a time to actually travel to the United States, apply for these away elective. With COVID, this being challenging to everyone, even for American grads, because for the last year, most of the hospitals actually stopped taking medical students. I think from July, they started to have medical students coming back, but January to July, most of the hospitals actually stopped having medical students coming in for electives or for their rotation. So this is one of the things you want to think about it. It's still an observation, or if you did an observership with a hospital, you want to think about how I can actually show my clinical skill and have the person who's writing my letter of recommendation reflect on my clinical skill and me knowing the system, and how you can actually integrate that, and they can integrate that into your information. So building that connection with the person who's writing the letter makes a lot of access for you. So use that opportunity to actually connect with the people. For research experience, as we mentioned, it's just to build good connection with people. And I know that some people were asking about how people get their research experience in the United States, or how you get the connection to get your research experience. From my personal experience, when I did my postdoc, I actually get the connections through personal connection. And that's how I end up getting into my postdoctoral degree. But also, people utilize different aspects to actually get into to obtain a research experience in the United States. So send people who are most published in the field and ask them if they do have research units, and if they have an elective, show you, prove that you're interested in the research. That could be one of the things. And Ethan and Malky also can talk about their experience for how they were able to do that. Other experiences also matter. Your volunteer experience, if you're able to tie that with your medical experience, will be also one of the things. The last thing I wanted to talk about is actually USMLEs, especially with what we were talking about earlier for score changes. So that's going to be American grads, like IMGs for the last couple of years were actually the one factor that was playing in our favor is the USMLE score. So people will have higher scores that help program look into that to prove that you have a good medical knowledge. So now with the change to pass and fail, it have the bonus on it, but also will have some of the draws into the IMGs where you're thinking about how can I prove myself, and that will factor into finding your away elective, try to get the elective in the United States, build your CV to be more comprehensive. I'm not saying don't focus on your USMLE because they're still important. Figuring out step 3 now may be a factor actually coming in if you're only taking only pass and fail, because they want to see if you're able. And USMLE step 3 is actually showing that you're able to practice from a clinical standpoint, and it can give some aggregate for if people will pass their boards or not. So that should be something you should think about also. But yeah, that's in general what I wanted to say. Thank you, guys.
Perfect. Thank you very much, Wigtan. So let's see if we've got any questions. I think there was one question with regards to some people who've already done the step one and have a numerical score. Do you think they'll be at an advantage, compared to someone who has a pass-fail score?
So knowing that this is not gonna, knowing that until 2022, so people who are applying this year and people who are applying next year, most likely they're not going to be affected by the change in the score. I'm not sure because every year when you're applying to your ERAS, actually you ask for a transcript. So your transcript, actually, when it's sent back from ERAS, it should be sent based on what the USMLE people want. So if at that time it's becoming a pass and fail, most likely your numeric score, when everyone changes into a pass and fail, your numeric score will actually disappear. The same way right now, all of us, if you have your step three is actually, you have a numeric score, but it still shows a pass and fail in your transcript. So my expectation is within 2022 going on, most likely this is going to change. And it's going to be just a pass and fail. So when you're sending it, still it's going to show just a pass and fail.
Actually, the USMLE mentioned recently that they can't change score back. So if somebody gets a numeric score, it will continue to be numeric score, and some people will be pass-fail. So in this situation, if you got a numeric score and you applied with those who got pass-fail, if you got a good score, that's going to be probably you will be put at an advantage. But if you didn't get a high score, you'll be put at disadvantage.
Makes sense. Okay.
We had another question where if someone doesn't have, a great score, so so like a borderline score, 240 or 245, or maybe less, is that a deal breaker, do you think, or there are ways to kind of remedy that through, I guess, step two scores or other aspects of the application?
So I'm going to talk about this. So you want to think about your holistic approach for your application. If you do have that, figure out a way to explain why you did have the low score and how you overcome it. And that's where the interview, practicing for your interview, practice for your weaknesses, because each one of us have somehow a weakness in your application that would be. So if you, in that case, maybe your score is the weakness in the application, figure out a way to overcome that by explanation for why you had that score and how you will overcome it and how this may not affect your performance overall.
Perfect. We've got another question. What is a good USMLE step one score for a competitive program as an IMG?
I will believe that actually varies based on your subspecialty that you're applying to, because they're different. And the NRMB is actually a great tool for people to go over. And so go to the website. They actually have each specialty with their scores for IMGs and for American grads. So look at the IMGs score, because that will be your average and the mean that people look at most of the time.
Perfect. I'm just going to introduce Millie, who's just joined. Hi, Millie. She is a plastic surgery resident at Johns Hopkins, so welcome. So let's see if we've got any other questions. So we've got another question here. Is it worth taking step one now before the changes, even though I'm only hoping to apply to residency in 2024 to 2026?
To be frank, I'm really not sure, because it's not going to make a lot of difference. If programs actually taken off the criteria by that time of not looking into step one, so they're going to be fair with everyone and they will look into that aspect. So if they're saying we're not looking into step one, then most likely focus on your step two, make sure your scores are good. And if that's one of the things, but it's become more also of a personal decision based on the situation for the person. And if they think they're ready to take the exam, then it's one out of the way.
Sure. Anyone else? Malky, any comments?
So they asked if they're planning to take their step one in 2024?
No, so they're going to be applying much later. Is it worth taking the step one now to get a numerical score?
If you're ready and you think you're going to get a good score by doing the MBMEs, just do it now. You don't want to wait 2 years after you're ready, because you've already achieved the the knowledge that's required to pass the exam. Because it's not easy to prepare for this exam, and you'll forget the information 2 years from now if you want to wait to make it pass fail. But if you're not ready, do it when you're ready. I think if you think you're gonna get a good score depending on the specialty by looking at the NRMP data and the average scores for that specialty, do it. If you don't think and you're barely passing, it might be better to do it pass fail.
Okay. Millie, any comments?
Yeah,
I
no,
like
I
to
agree
put people
with
on the spot.
No, that's fine. Yeah, no, I agree with everything that has been said so far. And excuse my attire, I'm working nights after this, so I got dressed for work.
Perfect.
And yeah, so it is a case of whatever's best. If you think, I know some people who are going to take the step 1 now because they know the numerical score will boost them. And I know some people who are purposely delaying it until pass fail because they want to just have a pass and they think the numerical score will hurt them. So it's about taking a hard look at what you think is achievable and picking the right route for you.
Cool. So we have got a question for maybe Anita and Millie. So we've got someone saying, what if you're an average student in the UK in terms of transcript? Will you have to explain that? This is something I didn't really worry about before thinking about applying until recently. And in the UK, you get a pass-fail versus letter grade. I don't understand the latter part of that, but yeah, if you're an average student in the UK, how will you explain that in terms of interviews or in the application?
Good question. I don't know how strongly they look at your transcripts, to be honest. My impression was that's like a kind of a formality, and then yeah, they might glance at it, but you know, the people looking at your application form you just want to get to the interview process. They have like 200 plus things on their desk. They're working, like, so I'm in plastics, so I'm going to say they're working surgeons, and on top of everything else in their clinical day, they've got this stack and they're just flicking through it. Like, remember that they've got very little time. Unfortunately, they're paying attention, and you've got to just bypass that. I don't think they're looking into your transcripts and all of that business. They're going to probably just look at your scores and other elements of it. And so then you just get to the interview process. I wasn't even asked anything about my university transcripts or performance, to be honest. I would at all. Along with that MSPE thing from our university, it's really basic. It just kind of said you did rotations. It doesn't really have anything else. So I don't personally think that was actually a big factor. And I think that's why you highlight your strengths and what you have got and other elements and what you're doing now and what's going to make you successful. So
cool.
I completely agree with Anita in that. And you have to also remember how your transcript looks completely different from the US one. So then they have to decide, oh, am I going to try and interpret this and spend time figuring it out? They probably won't. A top question that I always got asked was, can you just explain your medical school journey? So they don't even understand how med school really works in the UK compared to the US. So they'll most likely just ask you that if they're curious, and they won't. Looking through the transcript to try and interpret it is, I think that will, especially plastic surgeon as well. So maybe that's why I agree with her, but I think that's an extra step that you can't really expect them to take.
Agreed. Okay. We've got a question here. When is a good time in medical school to take the step to CK, and how long should you study for it? Here we go for Malky.
Yeah, so I think once you've done your clinicals or you're midway through your clinicals, that would be a good time. It varies between those who have 6 year of med school versus the 4 year. So if you're on the 4 year system, maybe between 3rd and 4th. If you're in the 6 year system, maybe in your 5th. But it varies. If you think that you have the knowledge from your med school or from the books that you've read, some people just prepare for the USMLE examination. They study their own material. So they study the Kaplan books, the Step Up to Medicine, the UWorld. If you think that you've prepared enough and you're ready to take it, go ahead. If you don't, but I don't think it's good to take the exam between your third and fourth, for example, in the 6-year system, because you haven't started any clinical and you're not very comfortable with the clinical decision making. So maybe a little bit after you start your clinical years.
Yeah. Okay, perfect. We've got another question here. Does it matter if your research was done in the UK, even if published, or is it more important to have it done in the US? I think we've answered this already, but let's go to Millie for this one.
I think research is research, no matter if you've got it published in the UK or the US. Well, on the application, it just shows up as like a line. It doesn't say done in the UK, published in the UK. It's just a publication that you have. The advantage of doing it in the US is having US contacts, getting those letters of recommendation from people who know you. So that's the true benefit of research in the US versus UK. But if you can get a publication in the UK, 100% get a publication in the UK. Great.
And what about in terms of, obviously we're in a pandemic and most away rotations have been cancelled, sub-Is, etc. So what can an IMG do now in terms of getting that clinical experience and to get those letters of recommendation?
I actually think that COVID has worked in IMG favor because the whole sub-I thing is it's more favorable for the US students. As someone who did observerships, and you can't scrub in, you can't operate, you can't really compete in the same platform as the US students. Now they're being judged on your terms, essentially. No one has met them, the foreign entity. Sure, you have the letters of recommendation, but you haven't seen the hard work, the ethic. Like, you're just seeing, okay, publications versus this publications. IMGs tend to have more because we're older and we do research more often. So I think it'll actually help you in this regard. And in fact, I was talking to my mentor who was complaining about the applications they've got so many this year, and they've said they've seen such a rise in IMG applications, and I think actually more IMGs are getting interviews as well. So yeah, the COVID, weirdly enough, has worked in our favor, I think.
That's a great point.
I think with the vaccine, things are gonna go back to normal maybe next year. So if you're looking for a research position, I think it's good to apply in a month and two. So things are gonna transition back to normal. And I agree, there has been a huge rise in the number of applications overall. According to ERAS, there was 400 applications submitted for plastic surgery, almost 100 more compared to last year. So 25% increase, and there are 75 IMGs who applied. So almost 10 more compared to last year.
It's interesting. Okay, how many months of US clinical experience is ideal to be competitive? I think that maybe you're referring to sort of pre-COVID era. We could talk about sort of pre-COVID versus now.
Good question. I think it also does depend on the specialty that you're applying to as well. I don't know if there's a specific thing we can say you need to have like X number of months. I think you just try and get whatever experience you can. Speaking to like US medical students, some of them used to say in competitive programs, the more sub-Is that they did, then they got interviews from those rotations, from those places. And even from IMGs that have done sub-Is or rotations, they've managed to get interviews at those places. So I don't know if there's a specific amount that makes you, I don't know, the others might have a different opinion or the same, but I don't think there's a certain value. It's like, do you have some, and what areas, and it's what were your reports from them? You want to have either the letters from them or or some sort of thing that that shows that you did well in those. It's going to be a testament from how you work clinically. Unless you've got clinical experience, this is how the program directors kind of can gauge how you might be clinically, which I think was considered important by quite a lot of the program directors I spoke to when I was applying.
Sure.
I agree with Anita. I think the only thing is the
No, sorry, carry on.
That was just the only thing I was saying is just make sure that you're working enough with someone that will be able to write that letter of recommendation for you, because that's why you're doing the rotation as an IMG. So if you work with them for 2 weeks, they're not going to write a good letter of recommendation for you.
Coming to Malke and Millie, I know you've recently done the research fellowships as such. How much time did you allocate to the clinical aspect versus research?
Well, for the clinical aspect, I did my elective when I was a medical student, which meant that for my elective, we had 2 months of elective time. So I was able to scrub in because I was covered by the university malpractice. So it was useful in that regard. And then I graduated and went into research. And then as a full doctor, you can't do, and sub-Is for the person that's a sub-internship, it's like you basically act as a mini intern, follow them around and do jobs and you operate. So I couldn't do a sub-I because I was a fully qualified doctor. So I did observerships, and I only did a couple of those because there's not much you can do apart from show that you're polite, interested, and kind of have knowledge. You're not allowed to even like you can't touch the patient. Some people are super strict, you can't even touch it. Like a patient can be falling off the bed and you're not allowed to help move them back on it. So so by the time I was a doctor, I shifted basically almost all my time towards research instead.
Great. Malke, anything to add to that?
Yeah, I agree, because when you're a researcher, you're not allowed to touch patients, you're not allowed to examine them, scrub in. So your time should be fully in research. What I did is I did some observerships. I went observed in the OR, but you're not allowed to actually practice clinically. It keeps you in touch. You can keep reading surgery textbooks or whatever specialty you're applying for. But my time was mainly 90% research and 10% to these other activities.
Brilliant. So I hope you found that useful. I'd like to introduce the High Yield American Residency Consultancy. I'm pleased to launch this today with our amazing speakers. And the premise of this was that the journey of an IMG to America is somewhat unique. And it's very difficult to, for example, run a course where you can kind of cover all the nuances for individuals and provide individuals with an individualized plan going forward. So that's one of the reasons we've launched this. And I'm briefly going to go through what this will entail. So the premise is to provide individualized, bespoke coaching through the process. And it's really to maximize your chances of matching into the specialty that you want. As I said, we've got a very high caliber team of consultants, so all the speakers today, and then we've got more consultants who've matched into competitive specialties like trauma and orthopedics, and we also have a couple of attending colleagues as well. A lot of the consultants have ranked very highly. They've scored incredibly well in the USMLEs, and we all have academic experience. So from a research perspective, everyone has strong backgrounds. And a number of the individuals have actually also been involved in recruitment and sat on the interview panels. So there are going to be different services available. So the first one is going to be the residency consultation. So here we will allocate you with the most suitable consultant. So whether you're applying for internal medicine or surgery, different subspecialties, we'll try and find the most suitable consultant for you. And then you will have a bespoke one-to-one, 1 hour virtual consultation where you will get a tailored, individualized plan on how to proceed with all the aspects of the application. And really to provide you with a blueprint on how to excel with clear goals that will be set by one of our expert consultants. And all the sessions will be recorded. You'll have access to the recording for life. For those of you who are already in the process and have actually got interviews coming up, then this option might be more suitable. So this is the High Yield Interview Coaching platform where, again, you'll be allocated a suitable consultant and you will undertake a bespoke one-to-one, 1 hour virtual consultation where the focus will be on the interview preparation in terms of useful tips, useful insights, and you will then undertake a structured mock interview and be provided with critical feedback on 3 aspects: so content, delivery, and presentation. And again, this will be recorded as well, and will be provided to you after the session. For those of you who are looking for more holistic support, we have the combined residency package. Once again, you'll be allocated the most suitable consultant, and this will involve bespoke one-to-one coaching encompassing 1 hour of consultation, 1 hour of interview coaching, and also personal statement, CV, or application edits. Recordings will be provided for the consultation as well as the interview coaching, and we'll also be launching a mastermind group, which will be a private forum for people who sign up to this, where fellow IMGs can post and answer questions. You can motivate each other, and you'll have oversight by our team. And then finally, the premier mentorship package, and this is a view out of Anita's future office. This will be a bespoke one-to-one coaching, and this is very intensive. It's 10 hours of high-yield consultation on any aspect of the application process, from residency application to mock interviews to USMLE guidance and research. All sessions, once again, will be recorded, and we will also offer you unlimited personal statement, CV, or application edits. You'll be part of the mastermind group, but in addition to that, you'll also get unlimited direct email access where our team can support you at any stage of the application process. And these are fantastic consultants. So we've already heard from Anita, Malke, Wigdan. I'd like to introduce Dr. Maj El-Harasis, who's currently working, so he wasn't able to make it, but one of my ex-flatmates who went on to do internal medicine residency at the Mayo Clinic, and he's currently a cardiology fellow at the Vanderbilt University Medical Center. And Millie, we've heard from her already as well. So she's a plastic surgery resident at Johns Hopkins. And we have 2 other consultants who've matched into trauma and orthopedics. And as I said, the team is going to be growing, and we will basically cater to your individual needs. So I'm very excited by this. We've got amazing consultants on board. And if you're interested, you can find out more on the website, which is highyielduk.com. And for those of you who've attended the webinar, as for the next 7 days, you can use this code, which is IMG10, and that will give you 10% off all programs. That's a QR code that will take you straight to the page. And if you've got any queries from any aspect of today, we weren't able to cover any particular question, you can email us at highyielduk@gmail.com, and we'll try and get back to you as soon as we can. So thank you very much. I really want to thank all the speakers who've given their time. Just so much experience, and a lot of work and achievements have gone behind for them to get to where they are now. So incredibly grateful to Anita, Wigdan, and Malke, and Millie for your time. Thank you so much. Those are our contact details. As I said, that's the email, and we are available on social media as well. So High Yield UK is the Instagram handle. We'll be posting a lot of useful stuff on there. Lots of events coming up, so do follow us on there. And yeah, thank you very much for listening. Getting a few comments in the chat. Thank you. Fantastic. So I'm glad people have found it useful, and look forward to having some of you on board in the residency consultancy for those who are interested. Otherwise, good luck in your careers, and I'm sure we will cross paths at some point.